Welcome back to the Unlicensed Therapist. What a pleasure to have you back. I am so grateful for your return. And for those of you who this is your first time listening, welcome, welcome, welcome. Thank you. I hope that you stay tuned in because today we are speaking with licensed psychologist Dr. Paulette Didia. Dr. Didia has an upcoming book that we're going to hear about. She speaks on topics such as the importance of the human connection in the therapy room, something that we've touched on but have never gone into a deep discussion on, so I felt that was important for us. But she also talks about AI and the future of therapy, and I know that that's a question out there for so many of us. So if you're wondering, is AI going to take over the counseling field? Should I be using AI? Should I not be? Is there an amount? All of those questions we're going to tap into and more. So sit back, relax, and Dr. Didia and I will be right back to start our conversation. And we are back with Dr. Paulette Didia. Dr. Didia,
Hi, Matt.
it is so nice to have you here, Paulette. I am excited. You
I'm
are the
excited too. Thank you.
You're welcome. You're the first person from out of state that I've had. So this is really a big move for me. Now, this may seem a little redundant to you, but I know I'm going to have listeners that don't know the difference between a counselor and a psychologist. So, can you explain what that difference is?
Yes. So a counselor is kind of this umbrella term, kind of similar to the term therapist, where it can be a licensed mental health counselor, a social worker, um, or any a licensed professional counselor. Psychologist means that I went to graduate school. I have a doctorate degree. I did 5 years internships, externships, and I think that's the main difference between a counselor being the umbrella term and a psychologist being the doctor term after having gone to grad school.
Okay. So I know that as a counselor therapist that we can have specializations. I am looking into drama therapy. I know CBT, DBT, different things like that. Trauma is my area of expertise. When it comes to a psychologist, what are their areas of specialization? And are there different types of trainings that they typically need to distinguish what type of psychologist you may be in the mental health profession?
I think similar to your journey, for me, I was also trained in CBT and DBT and psychodynamic therapy. I think a lot of pressure is out there to specialize. For me, I like to call myself pretty integrative. I see people that have bipolar disorder, I see people that have anxiety, I see teenagers, I see families. My graduate training was actually in child psychology, and it wasn't until I graduated that I started working with adults. And now that I have my own practice, I'm working with adults and trying to get back into some child and adolescent work as well.
Okay, awesome. Okay, so we sort of have the same populations that we work with, so that's really great. So this is going to help me in understanding some things, I think. We have someone who is looking for services. How do they know? Do I need a counselor? Do I need a psychologist? Do I need some other clinician in the mental health field? How do they figure that out?
I mean, it's a hard question to answer because it's based on so many different factors: needs, location, fees, and insurance. A lot of psychologists in the field are moving away from accepting insurance because what the insurance companies are not paying a livable wage for psychologists, and I'm assuming for counselors and therapists also. And I think that's something that I get a lot of pushback on when I'm doing consultations and I tell someone my fee. They're like, well, that's too expensive. I don't have enough in my budget for that. And that's kind of a really big pushback I get for people. So I think counselors, social workers are all dealing with the same thing, but it's really about just finding the right fit, both personality wise, but also budget wise, availability wise. Some people want in person, some people want virtual. I know since COVID, a lot of professionals that I know haven't gone back into the office. So that's something that I can offer my clients is an in-person space for them to come in every week. And a lot of people really appreciate that.
Awesome. And I'm seeing the same thing, that there are folks that are just like, no, I like the screen between us, and other people that are like, no, I want to be in a room and be able to reach out and touch someone. And I think I get both. What do you do, or how do you help a client who comes in and as you're talking with them, you're realizing that maybe a psychologist isn't the best fit? Yeah, how do you help them understand what they need? That they need a therapist versus a psychologist, that they need a psychiatrist versus a counselor or some other mental health professional?
I mean, I think it's hard to categorize. If I have a client, I would never tell them that they need they don't need a psychologist. It would be more, I don't think we're a good fit. I think we tend to see it more of like, if I'm working with someone and I think they could benefit from medication. I have a really close colleague that is a nurse practitioner that does medication management in a way that I think is wonderful, and she looks at the whole person as opposed to some of the other psychiatrists that maybe just say, here's the meds, see you in 3 months. So I will often refer some of my clients to her, just to check in, see if they could benefit from medication management. I don't know enough about it. I'm not trained as much in it. So I'll send them along to her, but we'll continue working together. And then if they work with her, we'll collaborate, the three of us, on the best course of treatment.
So, am I understanding correctly that really the difference between the counselor and the psychologist falls into the additional education that you get? Is there more, or is that what I'm? Am I picking that up correctly?
I think that's true for the most part. The only difference would be if someone chooses to specialize, like there's certain counselors, therapists that specialize in, let's say, something like EMDR, which I'm not trained in. So that would be kind of the only real difference is in specialty. If someone chooses a specialty and has extensive training in that I'm not trained in, then I'll refer them to someone that has more specificity in that realm.
And this next question is just curiosity. So, are
Yeah.
you someone who can do testing and assessments? So that, let's say I have someone who I think is on the autism spectrum, and I know that Paulette specializes in that, which I do not believe you do, but we'll just pretend here for a moment that I could send that person to you for that testing.
So, my graduate program at Pace University really specialized in assessment. We were trained in so many different assessments. I did a lot of internships and externships in assessment. The problem with assessments is you need materials, and the testing kits can cost thousands of dollars. I can diagnose someone with ADHD. I mean, I often have to diagnose if they're using some form of insurance benefits for the benefits to pay out. So I can diagnose by going through the DSM and doing some structured clinical interviews. But for autism, it's a little bit harder because, especially with kids, you need the like manipulatives, the blocks, the books, the things that will really help make that diagnostic information come to life more than just a back and forth conversation.
Okay, thank you. I want to sort of switch gears here and learn a little bit about you and find out what drew you into the field of psychology.
Yeah, it's a good question. I mean, psychology has always been a part of my life, personally, professionally. I think I saw my first psychologist when I was 3, 4 years old. And then through high school, I was always the the advice giver amongst my friends. I was always the person people can come talk to. I took my first psychology class in high school and I was obsessed, and it just kind of grew from there. And going through undergrad, graduate school, my love of it only grew. And it wasn't until I was in the field and working with patients one on one that I was like, this is what I'm meant to do, and this is amazing. And I love how I feel when I'm doing the work, and I love how I make other people feel. And it's just kind of a natural trajectory of my life.
Okay. Did you have any particular people, mentors, or just life events that shaped how you think about human behavior as a whole and healing?
I mean, it's a hard question. I think our whole life is just a cumulative learning experience. Um, I think when I was very young, my parents divorced. I was 3, so I have no memories of them really together. And I think that definitely put me on a different trajectory than someone in a different family situation. And I think that was one of the first indicators of, well, growing up, things were different for me. And they would have family days in school. And it was a little bit challenging. And I think from there was like, I felt at times a little bit alone of not knowing where I fit in. And I think that's what also helped me wanting to create a space where no one else really feels that way. And they'll have a space in the office with me where they don't feel that way.
So it comes back to wanting to give someone a sense of safety and
Yes.
acceptance. I love it. I love it. So as a counselor, there is a big discussion, I don't think big enough, to find your counseling identity. Who are you as a counselor? And I think too many counselors, it takes way too long. I'm going to imagine that as a psychologist who has gone through all that extra schooling, you had some more time to define that identity. So, what is your psychologist identity and how's it evolved over time?
I mean, you would think so. And I think that's a misconception because I think for me, I was learning all the theories in grad school. And I remember always sitting in psychodynamic class and CBT class and asking, wait, aren't we saying the same thing that we just said in the other class? And the professor was like, no, no, they're different concepts. So it wasn't until I was actually in the room with patients, noticing how integrative all of these theories are, and noticing that theories don't matter as much as sitting across from someone and really understanding their experience. So, my identity, I think, to answer your question, is someone that just listens and shows up to listen to the other person. Techniques aside, we'll pull from whatever technique we need, but it's more important to just have that back and forth conversation.
So, what I'm hearing is that even someone with a doctorate goes through the same things that those of us who are going through grad school right now or recently graduated, we all go through the same things, that those same growing pains.
Yes, exactly. And if you're a student and not knowing kind of where you fit into the field or how you could even help another person that may be different than you or older than you, you'll know when you get in the room with a person, it'll come to life in a way that you can't read about in the textbooks.
So, as being a psychologist who listens and sort of has all of those tools, theories, modalities scattered on the floor around her so she can reach down and pick up what is needed for that person. How does that shape not only your practice, but how you practice?
I think it allows me to offer something that not many people are able to. I mean, for if you're going to a therapist of any degree level that specializes in CBT or specializes in psychoanalytic training, you're losing so many other avenues to explore. So we can use a technique from CBT, but we can also do some insight work all in the same session. And I think that's what makes it a more holistic approach, that we're not just treating the symptom, we're treating the whole person.
So I'm hearing that you are a holistic practitioner. I'm hearing that you're an eclectic practitioner. Would that be correct in what I'm hearing?
Yes, eclective and or integrative is how I tend to define myself, more of an integrative psychologist.
Integrative. Okay, so is there a difference between integrative and eclectic?
I don't think so. I think it's just a personal preference. Integrative to me just sounds like all of these things kind of come together and form one bigger picture. It's just the way I look at it.
No, as you say it, that does make sense because if I'm the client and I'm being told I'm eclectic, well, that can be a little scary, but I'm integrative. I'm bringing things together. So, and that's what the client is coming to you for, is to feel more together 9 times out of 10. You have a book that just came out on Amazon, correct?
Correct.
Can you tell us about your book and who's it for?
Yeah, so my book is called The Human Therapist, on purpose called The Human Therapist, not The Human Psychologist, because I really want it to be for all practitioners, all clinicians, all therapists at all levels of training. It's really a book about my own human therapist journey. So it's not a manual. It's not, this is how you should practice. It's, here's me, all of my training led me to sitting in the room with a patient and how my human therapist journey evolved. So moving away from the neutral model that we were taught in grad school of like, you can't show emotion, you have to be neutral, you don't want to give too much of yourself to the client because it'll taint their experience. When I got in the room with clients, I realized that didn't work. And I give little anecdotes throughout the book of one time I forgot my umbrella and a patient asked me, "What's wrong?" And I said, I forgot my umbrella today. I'm super upset about it. They're like, "Oh, that happens to me all the time. I forget my umbrella." And it was one of the first moments where we connected not as therapist and patient, but as humans in the room together. So the book is really the journey of the different avenues and the different clients that I've met along the way that have helped me solidify that identity that we were talking about earlier.
It sounds like the perfect book for someone who is thinking about going into the field, someone who's in school, so they sort of have a better idea than what the textbooks are telling them, and great for those who have been in the field for a while just to remind them of, hey, this is why came here, not the techniques, not the modalities. It was to help someone.
Yes, exactly.
Was there a central idea or question that motivated you to write the book?
I mean, I think looking back at my graduate school training, realizing there was always a feeling that I had, like I said, even in the classroom, like something didn't feel right. And it wasn't until I started working in the room with clients that I realized this was the answer I was missing, and that no professor could have given me that answer, and no textbook had that answer listed. That it was just about being in the room, recognizing that this is the work. Even if we didn't use a technique that day, even if I feel like we didn't do any real work, the work is just showing up and sitting with another person, witnessing their experience. And that's what I want this book to show people, that you can feel like an imposter sometimes, feel like you didn't have the technique ready to go, but you did more than you really think you did.
I love you. I absolutely, because you're saying so much of what I have felt personally as someone who came into this field as a second career. These were things that, going through grad school went against the grain. I was being taught things that went against the grain of what just made logical sense to me. So it's so nice to hear someone else say this stuff. What do you hope? that your book shifts or changes in how therapists are trained or how therapy is just understood at large?
Yeah, I mean, I think my goal is and I offer some little tips in the book towards the end where I say, okay, the next generation of therapists, they're being trained right now. We have a chance to change the trajectory of how they practice and introduce these human therapist ideas. And one of the first tips that I recommend is as a supervisor, if you're in charge of educating these students, whether you're a professor, whether you're a clinical supervisor, not only asking the clinician what technique did you use, but how do you feel being in the room with that person, not in terms of counter transference or how does the client make you feel, but how does it feel for you to sit there and be another human in tune, and what kind of therapist do you want to be, not in terms of technique, not in terms of I want to be a CBT therapist, but what kind of person do you want to be showing up for your clients.
And again, I think people come into the field because they've probably been exposed to therapy themselves. And, oh, CBT is what I got, so that's what worked for me. So that's what I'm going to do. And you're right, it does shut down a lot of other avenues. I mean, I'm not going to lie, I'm guilty of that. I came in with a certain mindset of this is what I want to do, this is who I want to be. But as I saw different things, I kept going, well, let's pull from over here because this fits into that. And this fits into here. You know, EMDR that you mentioned, I never in a million years would have thought that that was something that I would have went for until my clinical supervisor said, "Oh no, sit back and think about who you're saying that you want to be and what this is like, and you'll see how this would be a great thing to have in your back pocket." And she was right. It's a wonderful thing to have there. Do I use it with every single person? No, because every single person doesn't need it. Every single person can't buy into it. What conversations do you hope that your book sparks among clinicians?
Yeah, I mean, I think the goal is not to make people chastise themselves for choosing a specialty, choosing an orientation. Like, I understand it might be a little controversial at the beginning of the book when I talk about why the blank slate theory of being neutral doesn't work, but it's not in any way, shape, or form meant to call people out or have this negative effect. It's just a way of saying this didn't work for me, which is why I said this is not a manual. This didn't work for me. Here's another idea for you to consider. You could keep doing your CBT work all day, every day. If that works for you, great. This is my journey. And this is just another way of thinking about things.
So it's an autobiography tied into a here's some clinical suggestions of what you could do if you wanted to.
Exactly.
Okay. How long have you been in practice? Or how long? Well, yeah, how long have you been in practice before you even started writing the book?
So after I graduated in 2022, I did 2 years in a group practice here in Manhattan. And then once my 2 year contract was over, I said, I think I'm ready to go out on my own and open my own practice. So I opened my practice November of 2024. And this book, I mean, I could argue that the book was always in process and in progress through my grad school career, but I really pen to paper or fingers to keyboard nowadays for about a year. So I was in practice about a year and then picked up the pen and started thinking about all of these things and putting it on paper. And that's been about a year in progress.
So the ideas were there, it was just the idea of it belongs in a book.
Yeah, it belongs in a place where other people can have access to it in such a real way.
Well, thank you very much for discussing your book Dr. Didia and I will be right back, and when we come back, we're going to talk about AI and the future of therapy. We're going to talk about connection and disconnection in the therapy room, and so much more. So stay tuned. We'll be right back. And we are back again with Dr. Paulette Didia, and we're going to talk about AI. And Paulette, one of the reasons I said yes is I have a dear colleague who probably once a month texts me with this question. And so I'm going to ask you, is AI going to take over the field of counseling? Why or why not?
It's a good question. It's something I've thought about a lot. For me, the answer is a hard no. There's so much that therapy can't be digitized. It can't be between a machine and a person. The whole reason therapy works is because it's between two humans. And I for the research on the chapter of my book, I asked ChatGPT, why can't you be my therapist? And that's how the chapter came to be. And it was really, really interesting what I found.
So, what core elements of therapy do you believe AI can't replicate?
I think one of the things about AI, and I know people will say that it's getting better, it's that every time you show up to a new AI screen, you're a new person. It doesn't remember what you were feeling last week. It doesn't remember what you were feeling a year ago. So if you have someone with clinical depression that says, I feel sad today, I don't feel like it's going to get any better, the AI just has a catalog of what it could say back, but it can't understand how that person is feeling. And maybe you or I haven't experienced severe depression like the client's describing, but we can certainly understand that feeling of sadness and feeling like things aren't going to get better. And that empathy, there's no contest. AI can't have any empathy because it doesn't have any feelings.
Mm-hmm. Mm-hmm. Exactly. Exactly. This sort of, I think you've sort of answered this, but I'm going to ask anyway. What aspects of human interaction, such as subtle cues, our emotional presence, that shared meaning, are essential to therapy, but it's difficult for technology to replicate or approximate?
Yeah, I mean, I think there's a line in the book that says something like, ask AI what to do when someone's voice cracks in the middle of the session. And AI doesn't know that. Even if you're doing a voice to AI conversation, quote unquote, AI still doesn't know what to do if a voice cracks, doesn't know how to read the body language, doesn't know what to do if the person's voice gets quieter because they're ashamed of what they're talking about. AI can't do any of those things. And it's only being there, being across from another person, whether it's in person or virtually, we can see those things and we can respond to them and we can ask about it. We can say, what's coming up for you? Why did you shift in posture? Why did your voice go quieter? AI can't do that because it doesn't even know what's happening.
So, we as human beings, when we're listening, when we're hearing, when we're being present, can take in those cues. We can put the pieces together to formulate a question, to gather more information. Where AI, garbage in, garbage out. It only knows what you put into it and nothing more.
Yeah, exactly.
What ethical or relational risks arise when people turn to digital tools instead of a human therapist?
I think the biggest ethical concern is that AI can't call for help. If there's real risk and someone's suicidal, AI can't do anything about that. They have no access to emergency services. for me, that's the scariest part of all of this is if someone's really struggling and really in danger to themselves and they turn to AI because they feel they don't have anyone else, AI cannot keep them safe. It cannot. And there's been stories I've heard, I haven't really checked into it, of AI saying, well, if you feel like hurting yourself is a good decision and you've tried all other resources, AI sometimes endorses that and says, go for it. And that's so scary to us as human clinicians. Our whole job is about keeping people safe. And here we have this AI tool that's telling people the opposite.
Yeah, I was going to bring up that same thing that I had heard. So, yeah, we're hearing the same thing about AI not having the ability to realize, well, empathy. If you think hurting yourself is a good thing, go ahead and do it. And then that's where you end up on the news and lawsuits and things like that. And hopefully, no one has harmed themselves, but unfortunately, odds are they wouldn't be on the news if someone hadn't have harmed themselves.
Exactly.
If AI can't replace a therapist, so it can't replace you, it can't replace me, what role do you see it playing as a tool for clinicians?
It's something that I've really wrestled with because AI is so prominent. And I've had patients come in and say, I used AI between our sessions to remind me of a technique, remind me of a tool, to just put my thoughts down on paper or on digital paper. For me, I say, like, I hear that. If that works for you, that's okay. You can also email me. With my clients, I have this connection where I tell them if they need anything between sessions, even if it's just, I want to vent, you don't have to respond. I tell them, send it to my inbox. Just put not urgent in the subject line and we'll get to it in the next time we see each other, or we won't. If it's just a place that you just want to put your thoughts down, send it to my inbox. It's okay. Because sometimes they don't even need the response that AI offers. Sometimes they just want to put it down and know that somebody on the other end is reading it. No, so it's not about saying AI is bad. It's saying here's another alternative that reinforces that human to human connection.
So for you, it's the AI should never replace the human connection.
Correct.
Hard stop there. What
Yes.
about AI being used to assist in, and I'm going to give a few things just to hear your opinions on all of them. Researching, progress note writing, assessments, diagnosing.
I think anytime we're relegating our own clinical decision making into AI, we're doing ourselves a disservice. We're not doing the work we were trained to do, which is to create these treatment plans, these diagnoses, these progress notes. I mean, if I had AI write my progress notes, I probably wouldn't remember as much of my sessions as I do. And I think it just takes away such a big part of the work that's on us to do. And this is what the clients are coming in and paying for and signing up for, is someone that will be there for us. And if we're just deferring to AI, we're kind of showing our patients that they can do the same thing.
So even that behind the scenes stuff still ends up, if we're using AI, it's taking away from that human connection.
Of course. And it's also doing ourselves a disservice to the point where it infringes on our well being. I use my progress notes at the end of each session to decompress from the session. So if it's a hard session for me, I write the progress note, and that's healing for me. And that protects me from bringing these cases home with me and agonizing over them. And if a if couldn't do that, if I couldn't write the progress note and AI was doing it for me, I would be carrying so much more home with me, and it would be so much harder to make it through the day and make it through the next session because I'd be so wrapped up in the last one.
So I'll admit I've worked at places where AI wrote the entire progress note. I've worked at places where AI wasn't used at all, and I've worked at places where AI assisted with the progress note. And obviously, in something like community mental health, where you are back to back to back to back to back, the temptation to have AI write the entire progress note just makes life easier. But you're right, you have so many people that you would get lost. You'd forget what you talked about. The assisting with it a little bit, I'm not gonna lie, it's nice. Does it hurt my writing skills? Probably, but it's nice that I'm putting things in there and there's someone or something else looking over it and going, yeah, that's spelled correctly. Yeah, that's worded more professional than what you put into it. Is it the best thing? Probably not. But it's the, what do we do when it's just part of that EHR system?
It's tricky, and I think I have the EHR system. I get pop-ups every day. Sign up for the new AI part of the system, and I'm just like decline. And I know it would make things easier, and I know it would make things move smoother, and I know I would spend less time writing progress notes. But for me, it's how I heal from the sessions, and it's how I built my whole human therapist journey is about, well, I'm asking the patients to be vulnerable. I need to be vulnerable too about how these sessions are really affecting me. And AI doesn't know that.
Yeah. How do you see AI influencing the way future therapists are trained, for better or worse?
I mean, listen, it's not going anywhere. I think it's an uphill battle to be on the side of we shouldn't embrace it. I think it's going to permeate. It already started permeating our therapy sessions. I think it's about making the informed decision of how you're going to use it, what makes the most sense, and most importantly, communicating with your patient that that's what you're going to be doing and that AI is going to be listening into the sessions or taking notes or recording so you can listen later. And I mean, recording sessions and having your supervisor listen to it is very different than recording sessions and having AI summarize it because you lose something in the summary. Even if you put in a text for it to summarize, it doesn't get all of it. It doesn't get all of the details, and you lose a lot in the details. So it's about asking yourself if you're willing to make that change or make that risk essentially of, sure, I'll get a summary of this 45-minute session, but what am I losing out on by doing that?
So, as AI permeates the field and you are the human presence, that is who you are, where can you in your practice see AI as acceptable and AI as unacceptable?
I think if a patient is wanting between sessions to be like, my therapist mentioned this tool, this technique, I don't remember how to do it. I need a mindfulness technique. I need a grounding exercise. Sure, ask AI. You can also just Google it and it'll come up also. But I think that's acceptable. I think online journals are acceptable. I know there's some AI being built into those. I think that's acceptable. Anytime it goes past the logical, past the thought process, into the feelings realm, I won't let AI touch that because that's our work.
Do you think the rise of AI tools is changing what clients expect from their therapists and how they seek out support?
I think there are going to be some clients that are looking for the new thing. It's like when COVID happened and everybody was looking for virtual therapy. And then once COVID was alleviating and people were going back in person, there were always those clients that are like, no, I'm happy with virtual. I don't need to go back to the way things were. And I think we're going to see a similar thing with AI of I want a therapist that incorporates AI into the session. And I wouldn't be surprised if 5 years down the line, there's going to be some specialty or subspecialty of like AI based therapy. But I think for me, this is what I'm about. I'm the human therapist. I can't let AI take that away from me. And the clients that want that human connection, which I think deep down we all really do, I think it's no contest.
So AI is going to be the analytical, not the emotional side of things, basically. Collect
Yeah.
numbers type of thing. Okay.
It's surface level. That's the
Yeah.
best way to describe it. It's surface level.
Yeah. If therapists rely too heavily on AI tools, do you worry it could weaken their relational or attunement skills over time?
Oh, 100%. You only get better at the human connection when you're connecting with humans. And if you bring a third person into the relationship, you're devoting your energy to different places. If it's me and the patient, it's me and the patient. There's no one else there. There's no one else listening. There's no one else summarizing. It's what I got from the session, how it made me feel, how it made the client feel, and that's all that really matters.
Therapists rely heavily on their clinical judgment. Do you think that AI can support that judgment? So I'll give an example of the new therapist who is questioning whether they're going to diagnose correctly. So they type into an AI what they're seeing and what they think the diagnosis should be, so that in the hopes that AI will spit out either yes or no. And we both know that that's not what AI is going to do. It's going to give a lot more than that.
Exactly. And I think the problem there is one, we're learning to defer to AI. We're learning not to rely on our clinical judgment. And if AI tells you you're wrong, think about it. If you're new to the field, if this is your first case you're diagnosing and AI tells you you're wrong, what kind of damage can that do to self-esteem, to the imposter syndrome, to the self-confidence of like, well, maybe this isn't the field for me. If I can't even diagnose someone that I was so sure has anxiety and AI is telling me, no, it's depression. No, they might be suicidal, but you didn't get any of that in the session. That can do a lot of damage to a new clinician in the field. And I think, like you're saying, it's not even yes or no. It's, well, here's what I think, and maybe, and here's the details you provided. But again, AI doesn't know how it made you feel. And when you're sitting across from someone, you can tell if they're depressed just from their body language, just from the way their tone of voice, just from the way they are slumped down on your couch. AI doesn't know any of those things. You can try to communicate that to the AI, but remember, AI doesn't know that because AI's never seen anybody slumped on the couch.
Mm-hmm.
So they can't understand it even.
Or even just because I'm slumped down, how I sit and how you sit are very different. So what might appear for you slumping and me could be two totally different things.
Right? And we know that as humans, we can tell the difference. AI can't do that.
Do you see a role for AI in psychological assessments or screening patients to see who might be the best clinician for them in a practice, or just for gathering data driven insights? And are there limitations or concerns that you have there?
I mean, I think even with screeners, we have our questionnaires that one could argue is the quantitative data. I'll know if somebody has generalized anxiety disorder, potential diagnosis based on the scale before they even walk in the room with me. To me, that's enough quantitative data that I need. I don't need AI to screen someone out because I even see my patients that are struggling to get jobs now
Mm-hmm.
because all the resumes get passed through the AI system. People are being passed on because it's not formatted right or because they didn't write the right word here instead of here. And what will that tell us if AI tells us this patient's not a good fit for you? You should just send them on their way. when you really could help them and could make meaningful change. AI doesn't know that. So I wouldn't trust it to tell me who I should and shouldn't interact with or take on as a case or collaborate with or consult on. I'd rather ask a human person, like, hey, I'm not sure if this person's a good fit for me. Can I run it past you? Can I have some supervision on this case? I'd rather do that because even if it's not human therapist to human client connection, it's human therapist to human supervisor connection.
So my last question on AI. Looking ahead, what do you think the profession of counseling and psychology will gain, and what might it lose as AI becomes more sophisticated?
I mean, for some people that indulge with it will gain convenience, will gain less time spent on client notes. Some might argue less time on notes means more time actually seeing patients. And sure, I can agree with that, but I think what we have to lose is so much stronger. And I think if we embrace it, we teach our patients that it's okay to embrace it between sessions. And then when a patient that we're seeing in person is then going to AI and realizing, hey, maybe I should just stick with AI and leave my human therapist. And then something really drastic happens or they're in a real crisis. AI is not going to know what to do. And it's going to make them feel like they can't go back to this therapist that they severed the connection with. So now what does it leave them with? This AI that can't help them.
Or in some situations, the person who severs that connection and then that slot on that therapist's calendar is taken up, that real estate is gone. So even trying to get back with that person is a struggle, not because AI told me not to, but because when do they have the time now to see me? That was your time specifically.
Yes, exactly.
Let's talk a little bit about, well, we're going to talk more about connection and disconnection, but we're sort of going to push AI to the side for a bit. Why is human connection so central to psychological well being?
Yeah, I mean, I think therapy aside, even as young as infants want that connection with another person. There's so much research on mother infant connection. Even as soon as a child is born, they say put it on the mother, skin to skin contact. From that very minute, human connection is born and is important. And I think the research is there showing videos of infants interacting with their caregivers, interacting with other humans. We want to be mirrored. We want to feel like someone understands us. We want to feel like someone is interacting with us and making us feel happy or sometimes sad or sometimes angry. But that connection of being in the room with another person, feeding off their energy. I mean, it's the greatest feeling in the world when you're with a big group of friends and everyone's just laughing at the same time. Those are the things that make us as humans so special, is that we're one of the only species that needs that biological connection in that way.
When you talk about we need people to help us or make us feel happy, that resonates. I had never thought about the other emotions and how that's equally as relevant. That, yeah, we can all be angry at the same thing, we can all be sad about the same thing. That's not a bad thing, that's just being human.
Yeah, exactly.
Where do you see people struggling most with disconnection today?
I think it's something that I feel like as a society, we haven't recovered from COVID. We haven't recovered from sitting alone in our houses and being isolated from the people we care about. And I think the people that were able to quarantine with their core group of friends or family was so lucky in that way that they were able to sustain that connection. And I think the isolation and the loneliness of living alone, being alone, not interacting with other humans on a day-to-day basis is, I think, the biggest threat to happiness, because connection, I would argue, is the way we achieve happiness and contentment with our lives.
I was talking with some associates who had a child during COVID, and they talked about how, their child, of course, never met their cousins, never had any school time, nothing like that. And so, as a toddler, they're finally able to go to the playground and get to the playground, and every kid who's on the playground, instead of playing together, are going 20 different directions to do their own thing, none of them thinking to go to one another, and the parents trying to redirect them and get them to socialize, and that was a real struggle for these kids to understand that that's why they were being brought to the playground, not to go off on their own and do their own thing.
Yeah. I mean, I think we see that with kids that are maybe in the playground but are on their iPads and can't get away from that screen and don't even notice that there's people around them that they can be in connection with. And I think, I mean, the iPad aside, I think that's a real big threat to the development of the next generation of children.
So you jumped right into my next question. Do you see technology, especially social media, contributing to this disconnection?
100%. I mean, I see it with adults even, this, well, I'm comparing myself, everyone's doing so much better than me. And as many times as I say, well, that's what social media is. It's everybody's highlight reel. It's people are not posting when they're having a bad day. They're not posting when they're having a breakdown. They're not posting themselves in tears because something didn't work out for them. So you're comparing yourself with all of your complex emotions to the best days of someone's life. It's not going to be an even comparison, and it's just going to make you feel worse about it. And social media is just magnifying that and emphasizing it to a degree we never saw before that.
Mm-hmm. Mm-hmm. What makes you what makes the therapeutic relationship uniquely powerful compared to other forms of support?
Yeah, I mean, I think one of the questions I get a lot is, I don't, or one of the statements I get a lot, I don't need therapy, I just talk to my friends. And it's something that I talk about in the book, that I explain that with friends, the idea of being friends with someone is this reciprocal connection. It's, you'll give me advice because I've given you advice. You'll help me with my problems, but then you'll also listen to my problems. And then I'll listen to your problems. And there's this reciprocal back and forth where maybe you don't feel better. Maybe there's still more you want to talk about, but now it's the other person's turn to talk about their feelings and their problems. And therapy isn't like that. It's the only relationship where you can talk for as long as you need to about whatever's bothering you. And there's no reciprocal, well, now I have to listen to you. And now I need to help you with your problems. And every other connection in the world is that reciprocal connection. Business partners, you do something for me, I'll do something for you. Therapy is not that. And I think people really underestimate what it means to have 45, 50, an hour a week just for them.
And there's no having to feel of I'm being a burden talking about these things to your therapist. And it's not even that your therapist is being paid to do it, they're trained to listen to these things and assist you
Yes,
to heal.
exactly.
All right, I will be right back with Dr. Paulette Didia here in a few moments, and we're going to jump into and talk about authenticity, identity, and clinical work. And Dr. Didia and I are back from our little coffee break. And now we're going to talk about, as I said, authenticity, identity, but we're going to connect that to clinical work. So, Paulette, many therapists feel pressure to perform professionally by hiding their true selves. What psychological cost does that create for clinicians?
Yeah, I think there's so many costs. I think the first one being it's exhausting pretending to be someone else and pretending to be this buttoned up, starchy version of ourselves where we have to hold in our emotions, hold in our initial knee jerk reactions. And no wonder why we're all exhausted and burnt out at the end of the day because we spend so much of our time sitting across from someone else, but holding in all of our humanity. And I think the other main cost is that we're doing a disservice to the person sitting across from us. We're not letting them see who we are. We're not letting them see our flaws, see our humanity, see the fact that we struggle sometimes too, and that it's okay. And I think those are the two main costs that I see a lot by pretending to be this professional, no mistakes, I never have hard days version of ourselves.
In community mental health settings, therapists often limit what they share. It's obviously because they've got a lot of people coming in and they can't pick and choose who they're going to work with. Someone else is doing that. What's your perspective on how clinicians should navigate personal beliefs, spiritual, political, cultural, in the therapy room?
It's a good question. It's something that I've experienced a lot recently of having clients that maybe I've been with for 2 years now that then it comes out that we are on totally different ends of an issue. And maybe I don't tell them this is how I feel about it, but I listen to how this issue is affecting them and I listen to what they're feeling, what they're thinking, how they're feeling that an injustice is being done or something. And I help them figure out the next course of action for themselves. Is it, do they want to talk about it? Do they want to seek a support group? Do they want to do some social justice work? My thoughts are my thoughts and my feelings are my feelings. And some patients might try to get that out of you and be like, but you agree and you feel the same way. And whether I do or I don't is not important here because, like we said, this is not a reciprocal back and forth. We don't have to debate this issue. This is an important issue for you. And it's my job to make this an important issue for us.
So, are those parts of yourself that you do keep sort of wrapped up tight and hidden?
I think it's not wrapped up and hidden. I think it's just I make that judgment call in the moment of like, this is not going to help the patient to know that I'm on the other side of the political spectrum, that I'm on the other side of this social issue. It doesn't help them in the moment. So why would I disclose it?
So it comes back to individualism and do no harm. If it's not going to harm the individual and they can handle the information, why not share it? If it's going to damage the therapeutic relationship, don't share.
Yeah. I mean, I think there's always going to be people that maybe toe that line one way or the other too far. But for me, I've noticed my patients are receptive to when I say, like, I've struggled with that also. And it's hard to get up there and give a presentation to all of the bosses and 20 people. Like, I've struggled with that also. I know what that feels like. And I'm not making it about myself. And I know I don't need them to make me feel better, but it helps them to know that someone else is struggling with this also.
When therapists suppress an aspect of their culture, their personal or emotional identity, how does that impact their long term well being and their clinical effectiveness?
Hmm. I think I think it's exhausting and I think it doesn't have to be so exhausting. I don't think we have to work so hard to hold ourselves back. I think it's about recognizing. I know how I feel about this. It doesn't do any service to the client to reveal that. I just tuck it away. It's not stifled. It's not packed in a box. It's not in a corner. It's real. It's true for me, but that doesn't mean I need to share it. And it can stay in my brain. It can stay in my heart. It can stay wherever it needs to stay. I don't have to work so hard to stuff it away because that's where the exhaustion comes from.
So, what about, and I'm thinking about those individuals that are coming in and that you said they're looking for you to agree with them in 53 minutes of, but you agree with me. Yeah, I'm right, right? I'm right. And as you said, I'm not stifling it, but no, I don't agree with you. And saying I don't agree with you might make me feel better, but it's also going to torpedo what we've done so far. So, where's the balance? What do, yeah, in your opinion, what does someone do in that situation?
I mean, it's definitely hard. And you definitely, there's the patients that will test you and that will ask you the questions. Do you agree with me? The are you married question, the idea that they need to know all this information about you. And in the book, I talk a lot about they don't really care about your answer. They just want to know that you're a human that has a life, that has opinions, that has ideas about the world, and that even if we don't agree about something, sometimes if that comes up, I'll say something like, this is such an important issue for you. I understand why this is important for you. And it's the difference between validating and agreeing. I can agree and I can validate that this is an important issue for you. I can see why it has such a significant effect on your life. I don't have to agree with it, but I understand it.
What have you seen, or what have you even been able to collect through data that clients typically want to know or see to prove that you are human?
I get questions like, what did you do over the weekend? Or, I mean, are you married is a big one. I tend to not get it, but I know a lot of my colleagues do. Um, they'll ask me questions. I mean, it doesn't happen so much anymore because I feel like a lot of my clients have been with me for a while, but how was your weekend? What did you do over the weekend? What are you doing on your vacation? If I tell them I'm going on vacation, I'll be out for a couple weeks. I get a lot of those questions. Are you allowed to tell me where you're going? Are you allowed to tell me who you're going with, what you're doing? Then when I get back, what did you do on the vacation? Things like that. I think they just want to know that I'm a human, that I need a break, I need relaxation, I need to step away so that I could come back and continue being this therapist that you've come to know and see every week and is there for you.
And does it come back to that individualism of what each client can handle is what you share with them?
100%, 100%. So some clients know that I went to Greece a couple years ago. Some clients don't know that because it depends where we are in the therapeutic relationship. It depends where they are functioning level. It depends on why they're asking. And I think all of that plays a part here. And it's something that I need to kind of run through those questions really quickly in my head before I give an answer.
And that can be, it feels like you're on the spot. And it's just something that maybe you just have to get used to, that this is going to happen, and this is part of being a psychologist, a psychiatrist, a therapist. What can leaders in counseling and psychology do to create environments where clinicians feel safe showing up as their full selves?
I think the first main thing is to not criticize them for it and not make it feel like it was a mistake. If a client asks how their weekend was and the clinician goes, "Oh, it was good. I stayed home. I cleaned my apartment." Whatever it might be, the first step is I've had so many supervisors that made me feel bad about what I did in the room with a patient. And it was really, really hard on my self esteem, really, really hard on my confidence level of like, How did I do something wrong? They asked me how my weekend was. I said it was good. Why is that a bad thing? And I think for supervisors, it's so important to ask what was being pulled out of you that made you share that information. How did the patient react to that information? This is the type of therapist that you're wanting to be, someone that tells your patient, my weekend was good. How was yours? Or my weekend wasn't so good. It rained all weekend. How was yours? That's okay. And I think normalizing it is the first step that leaders need to do and make it okay for students to show up as themselves, because that's how we avoid the exhaustion. That's how we avoid the burnout. And that's how we make well rounded clinicians that are in touch with who they are and who they want to be as they move through the field.
The more we talk, the more I hear this message of be yourself, but be aware of how being yourself will impact the person sitting across from you. And you give what is best for that individual. And
Yes,
you're not hiding yourself, you're just limiting what that person needs to know. No more, no
right.
less. Okay.
And I think it's the difference between facts and emotions. I'll tell a client if their story makes me feel sad for them. I'll tell a client if I feel happy that they got this job promotion. It's the facts, it's the personal information that gets limited, but the emotions, that's all real. And I think that's the part that is the most exhausting to hold in, because emotions just come up. You could all of a sudden feel elated. You can all of a sudden feel angry. And sometimes I've told the patient, I feel angry for you, even if you don't feel angry right now. That was messed up what that person did to you. And it gives them permission to feel those things too. So, yes, limit the facts, limit the personal information about yourself, but never limit the emotions, because that's where the work is.
How does authentic connections among colleagues and supervisors strengthen clinicians' well being and collaboration?
It's a question that I've been struggling with since I started my own private practice. Like, it's just me in my office, it's just me. I don't have another clinician working with me. And sometimes it is isolating to just like look around and want to go talk to someone, not have anyone here to talk to. And that's when I lean on my therapist friends that are also in the same situation. And this is why one of the things I'm doing with my book is I'm starting this, the Human Book Club, where we can come together and talk about these experiences and create that community of all of the like stragglers, individual private practitioners that might not have anywhere else to go or anyone else to talk to. That's the space that I'm trying to create. And it's something that I've had to go through myself and dealt with that loneliness that informed that idea for me.
What's one thing you wish people understood about therapy and human connection?
That they're the same thing, that you can't have one without the other, that without connection, the therapy doesn't work. And I think we've operated under the either or mentality for too long and it's not working.
What does being human mean to you in the context of your work and your life?
It means just showing up, good, bad, ugly, flaws, strengths, just being yourself, because it's too exhausting to try to be someone else. And it's something that also took me a while to figure out, both personally and professionally, of how can I just be myself, and the right people will surround themselves with you and the right people will continue to stick around. And maybe I might lose a client to another therapist because I shared too much, or because they felt that I was having too many emotions for them, or whatever it might be. But there's always going to be the clients that line up for it that are like, I want to feel like we're in this together. I want to feel that you understand me and that your feelings understand my feelings.
Dr. Paulette Didia, it has been wonderful having you. Thank you so much. Would you come back another time and talk about some more things with us?
Of course, anytime.
Oh, wonderful. Where can people find you Where can they
Mhm.
learn more about your work? Where can they find you if they want you as their psychologist? And of course, where can they purchase the book?
Yeah, so my website, makingmeaningpsychology.com, has everything. It's how to contact me, it's how to find the book, it's how to join the Human Book Club, it's whether you're looking for individual, couples, family therapy, it's all there. And then the book itself, you can do a quick search on Amazon, The Human Therapist, and it should come up. It's available paperback, hard copy, and now Kindle version also.
Oh, awesome. And when are you having the Being Human book club?
So there's 5 parts to the book. So I do 5 week cycles. So every week we'll read a part of the book and talk about that part. Right now it's Thursdays at 1 p.m. Eastern time. But in the next iteration, it could be a different time, a different day. So you can also sign up on my website to be updated when these new dates and times drop also.
Well, again, thank you so much. And I look forward to talking with you again. And I know that everyone out there who hears this is going to be looking forward to talking and hearing from you.
Thank you.
You're welcome. Thank you. If today's podcast inspired you, if it gave you an idea of how being human in the therapy room is so much more important than maybe you ever realized, if it had you thinking about how you interact with AI or how your client interacts with AI, or you know people that are maybe struggling with these issues, hit the subscribe button and share this podcast. Remember, everyone, we're always unlicensed as long as we continue to learn. We'll see you next time.